Bulimia nervosa is the next eating disorder. Recurrent episodes of binge eating is the first criteria. And this is eating within a 2-hour period an amount of food that is definitely larger than what most individuals would eat in a similar period of time under similar circumstances. So the undertext to this is that if everybody's doing it, it doesn't count, right? So Thanksgiving dinner is not a binge because everyone's overeating, right? So if it makes sense in the culture because of the situation, that's not a binge. That's just everyone overeats at this meal, and it's just a thing. You also have to experience a sense of lack of control overeating during the episode. So there's this feeling of, I can't stop, I can't intervene, I have no power in this situation. It's a very, overwhelming and scary feeling. So you have the episodes of binge eating, recurrent inappropriate compensatory behaviors in order to prevent weight gain. So this is the purge, right? We have self-induced vomiting, misuse of laxatives, diuretics, medication, fasting, excessive exercise. So all the same compensatory behaviors you saw in anorexia nervosa also can exist in bulimia nervosa, thus kind of complicating the diagnostic process. And why you have to have a really clear picture of kind of what the person's dealing with and kind of what the clinical situation looks like. Binge eating and appropriate compensatory behaviors both occur on average at least once a week for 3 months. Self-evaluation is unduly influenced by body weight and shape. And then we have the exclusive kind of letter E, does not occur exclusively during episodes of anorexia nervosa. So if the person already has a diagnosis of anorexia, they cannot also have a diagnosis of bulimia. That's when you would be leaning more toward anorexia nervosa binge purge type instead. And you see there's also not any diagnostic criteria here about weight, because again, that's not part of what makes someone who has bulimia bulimic. Most people who have bulimia are at an average or slightly above average body weight for their height. Signs of bulimia. So again, this is what you would observe in a casual setting or in a clinical setting. You may find that there's disappearance of large amount of food, or you may actually find like the evidence of binges, so leftover food, or you might find wrappers hidden somewhere. A lot of times vehicles, bedrooms, trash cans are popular places to find kind of just like massive amounts of food wrappers. Evidence of purging behaviors, frequent trips to the bathroom after meals, signs and or smells of vomiting, presence of packages of laxatives or diuretics are things that you would look for. Again, they may have an excessive and rigid exercise regimen, because that is also, remembering, a form of purging. Unusual swelling of the cheek or jaw area. So what this is right here in our face and throat, we have parotid glands. And when someone is purging extensively or has been purging and stops, what you can find is that a person's parotid glands swell. And they can almost get this kind of triangle face shape, which is really interesting. And it's definitely something that can be medically treated, and it's not really painful or anything. It just looks bad, so to speak. So a lot of people want to avoid it. So they may, they say, okay, I'm going to stop purging, and they stop. And then their face swells up, and they say, like, well, I don't want to look like this. And they can go right back to purging. So that's why, especially for our really chronically bulimic patients, they need to stop purging in a facility where they can have containment. You may see calluses on the back of the hands and knuckles from self-induced vomiting. This is called Russell's sign. However, this isn't like something that you always see on patients because they may use a tool like a toothbrush or something like that to induce vomiting. So it's not like a guarantee. Their teeth may have damage, staining, discoloration from vomiting. Complex lifestyle schedules, and potentially excessive use of gum or breath fresheners again. But this is because not to necessarily kind of stop the hunger cues, like the anorexic patients would be using it, but it's to cut, well, I guess, it could kind of go both ways, but it's really to cover up like evidence of purging or vomiting. Health consequences, very scary, because they can kind of come in without warning with bulimia. A lot of times bulimia, people kind of have the thought that like, okay, so bulimia is not as bad as anorexia, right? Like, it's not as serious, but the health consequences are equally serious in different ways. When you're purging a lot, you can develop electrolyte imbalances in your body that can lead to irregular heartbeats and possibly heart failure and death. So a lot of times people who have bulimia, if they die from their disorder, it happens this way. They experience cardiac arrest because their electrolytes were imbalanced. They get very low levels of potassium and sodium, and that's very dangerous. You can also have inflammation and possible rupture of the esophagus because there's been so much stomach acid. Tooth decay and staining, chronic irregular bowel movements, and heart arrhythmias and cardiomyopathy. So again, a different flavor of health consequences, but no less severe than the consequences from anorexia. So still something to take very seriously. Thirdly, we're going to take a look at binge eating disorder. So some of this is going to look familiar because the diagnostic criteria for binge eating is exactly the same as with bulimia. We're still having those 2 hours where the person's eating more food more rapidly than a typical person would eat in that setting, and that sense of lack of control over eating. Those things are exactly the same. However, you also have the addition of letter B, which is binge eating episodes are associated with 3 or more of the following features: eating more rapidly than normal, eating until uncomfortably full, eating large amounts of food when not hungry, eating alone because of embarrassment at how much one is eating, feeling disgusted with oneself, and depressed or guilty afterward. So the reason that this is different from bulimia in terms of the binging episode is that a lot of times people who have bulimia may not have that sense of like deep shame in terms of eating in front of other people. They might, a lot of times our patients who have anorexia also feel very embarrassed eating in front of other people. But for people who have binge eating disorder, it tends to be a particularly present feature of the disorder. And so a lot of times you'll find that people who have binge eating disorder may try very hard to eat either a normal portion or even very little in the presence of others, and only when they're totally alone will they engage in binging episodes. This occurs at least once a week for 3 months, and they must experience a marked distress regarding binge eating. So of course that's, a little gray, what counts as marked distress, but this is a person who feels absolutely powerless to stop what they're experiencing. They don't even necessarily want to be engaging in the binging behaviors. They may set an intention, I'm not going to do that today. I'm going to turn over a new leaf. I'm not going to engage in that behavior. And they literally have no ability to interfere in that cycle. Not part of the diagnostic criteria, but another thing that you see pretty frequently with binge eating disorder is also restriction. So you may find that a person will restrict through the day, and part of our dietary model is actually that if we can stop the restriction from happening and help the person have satisfying meals throughout the day, that then we can actually decrease the urge to binge in the evening. So it's kind of like taking those, allowing that person to get comfortable and have exposure to eating the foods that they typically binge on in normal amounts, in a normal setting around other people. And so we find that if we can help the person feel satisfied during the day, that the urge to binge decreases. So that's also, I think, something that is pretty common in this disorder. Signs of binge eating, similarly to bulimia, you may find the evidence of binge eating and also the complex lifestyle rituals. And you'll notice, though, again, the thing that sets bulimia apart from binge eating disorder is the presence of compensatory behaviors. Binge eating disorder does not include any compensatory behaviors. There's extreme guilt and shame and embarrassment following the binging episode, but the person does not have that, that next thought or that next urge to say, okay, I gotta get rid of this. I gotta make up for this. I gotta burn this off, you know, like a person who has bulimia would feel. So there are no compensatory behaviors in the diagnosis of binge eating disorder. And that's an important distinction as well. So that if the person is engaging in any compensatory behaviors, binge eating disorder is most likely not the correct diagnosis for them. Health consequences of binge eating disorder. Oftentimes, type 2 diabetes is a very big consequence. Other complications from obesity, such as high cholesterol, high blood pressure, high triglycerides, and fatty liver. Infertility, sleep apnea, constipation, urinary incontinence. So again, this is, and you can kind of think about the 3 slides we've seen so far of health consequences. And you can imagine yourself as an insurance representative trying to provide authorizations for 3 patients with 3 different disorders. And a lot of times when they see the binge eating disorder patient, they are less likely to provide coverage for that patient because they don't feel that, you know, somebody with type 2 diabetes or sleep apnea is quite at the level of severity as someone who has osteoporosis at age 20 or whose esophagus is about to erupt. You know, and so there's what we've experienced, because we at ERC, we have a program where we treat binge eating disorder in in adults. We find that those patients often get less insurance authorization, less days approved, than our patients with anorexia and bulimia. Although the eating disorder is no less emotionally severe, because the health consequences are not quite as severe. Unfortunately, those patients are frequently underserved. And so that's something that, you know, we're working really hard to raise awareness about, and so that those people can get the help that they need and aren't discriminated against.